I am really, really glad to be able to be here with you today and to share some insights from somebody who is a chaplain. His name is Michael Cobbina, and he's a manager of administrative services and volunteer services with Kaiser Permanente Santa Rosa Medical Center. And also, Michael, you are the co-chair of the Spiritual Care Leaders Peer Group for Kaiser. I really appreciate you being here with us today. As many people know, I am particularly interested in speaking with chaplains and hope to speak with many chaplains across the world, really, specifically during this time of COVID, on the subject matter of the safety in our medical care system. We are often seeking chaplains and our spiritual care advisors on this important subject, but I think particularly so at this time of COVID. So welcome, Michael, and thank you for being here.
Thank you, Glenda.
Michael, is there anything else that you would like to say about your role as a chaplain and the many roles that you serve in that I didn't touch upon, just so people have a sense of what you pay attention to each day?
Sure. My role as a chaplain basically is to provide comprehensive spiritual care and counseling to our patients, their loved ones, and our staff. And so we're here for everybody. And that means that we serve as companions to our patients, their loved ones and staff. And it range, it's a kind of a wide spectrum of things that we do. We can just be there for people who just want to be present with them, offer a listening ear, compassionate ear. And also sometimes somebody will request for prayer, and we offer that. Mainly it's just to journey with the people that we're privileged to journey with, to be able to, as they all navigate the complexities of the healthcare system, but also, people come in vulnerable. And so to know that there's somebody there who will just listen non-judgmentally and journey with them. So that is kind of in a nutshell what my role is.
Thank you. I can imagine that during this time, what a lot of people want to hear about, and I think maybe particularly from people who have a role like yours, is what has been the impact of COVID on you, both either personally or professionally?
That's right. As we all know, COVID kind of came upon us without anybody's, nobody prepared for that, as it were. And so we are responding as we go along. That means being flexible in the way we provide spiritual care. So for instance, those days that I'll be with a patient or loved ones in the close proximity, I have now to pay attention to the distancing. Sometimes I have to talk to people on the phone. And so some of my colleagues are doing video calls. And so our approach to spiritual care is changed. However, the fundamental, place or the fundamental point or fundamental role that we have as spiritual care hasn't changed. How it's delivered is what has changed. And so we continue to be present, offer listening ear, empathetic listening, compassionate. We continue to offer prayer on the phone with patients and loved ones. And then we continue to be present with our colleagues here who are also going through the same, COVID experience. That is how COVID has kind of impacted how we offer care. I think underneath that all, what brings all this together is the fact that we believe, and personally I believe, that I've been called to be a compassionate presence, and that continues in whatever format I provide a care.
There's one thing that I would love to help people who may not think about what they need or how they might have their needs met if they are entering a hospital unexpectedly, or as under circumstances of either COVID or some other urgent need, and as well those who do go there to work each day in whatever role they may have. And that is that most hospital systems, and yours certainly being one among them, have this role of chaplains, spiritual guidance, listening ears, non-judgmental places that they can go to just say what's true and have a listener. A lot of people wouldn't even think to ask for that. I know I didn't when I was in the hospital with my husband in 2012. It didn't even occur to me to call on a chaplain. So is there any words of wisdom that you would like for others to hear if they either are in a hospital setting right now as a care deliverer or receiving care, or somebody who may be at some point in the future?
Sure. We are fortunate with this hospital system that I work for, Kaiser, but also this particular hospital. And it's true for many hospitals that I've worked for. I've worked for about 4 different hospitals. So here we, and it's also a standard for Joint Commission. And so when patients come in, part of the initial assessment is finding out if they have a spiritual or religious need. And so everybody that goes through our admitting process is asked that question. The same way when the patient, the nurse is doing the intake of their patient, there's a requirement on Health Connect that they ask those questions. And so when they check the various boxes, I get an alert that this patient, this is the initial identified need, and I go in and I do my assessment. Sometimes the alert I get might be just very basic, that this person indicated that they have a spiritual need that they would like the chaplain to visit with. And so I go and I do my assessment and find out what the need is really, is, and how we can journey together in addressing those needs. So particularly in these times, especially when family members cannot visit, visitors, it's kind of monitored, as it were. It's important that, patients and also providers know what chaplains bring to the table so that they can make referrals. Again, we not only nurses or admitting team, but we get orders from our physicians. We basically get, and I've gotten requests from EVS staff. So we are very much integrated in this facility that I worked in, and then Kaiser, we have about 51 chaplains in the Northern California. And just this afternoon, we met to talk about how to take care of our patients and their families and staff in this context that we find ourselves. So we have 2 weekly meetings. We started with a weekly meeting, now we have 2 weekly meetings. And so ongoing to find ways that we can offer care to meet the current need.
And I would imagine that need has a wide range depending on the spiritual traditions of each and every person, and that you are likely trained and efficient at meeting a person wherever they happen to be, even if they don't necessarily affiliate with a particular religion, but just want the attentive listener and the compassion, empathetic ear that can be that can be present for them in their time of need.
Mhm.
Michael, if we could, one of the things that's striking to me about this time during the COVID pandemic is that, I think I mentioned to you, and most of the people who are listening to my interviews know that my husband died from a hospital associated event in 2012. One of the first thoughts on my mind was, how did it impact the caregivers that spent those 13 days with us and were so attentive to him? I knew that they would be impacted by the event of his death. Certainly not to the extent that our family members were, and his loved ones who were close with him, but I knew they would be impacted.
Mm.
And I'm curious, you must see safety related events, or even if an error happens and harm doesn't happen, there is an emotional impact on the individuals who are involved in that experience. Can you speak a little bit to your experience as a chaplain with regard to that? How do you address those kinds of situations, and have you found it helpful to have chaplains at the side of those loved ones, those patients, those caregivers, even those administrators who may have been impacted by setting a policy in place or not setting a policy in place that could have prevented some of those errors?
Mhm. Yes, and I think I agree with you that everybody involved in situations like that, harm or a mistake, an error, is impacted. Certainly, degrees of impact, but I certainly have come across our staff who can't forgive themselves for committing that error or being part of that. And I have come across people crying, weeping, sobbing uncontrollably because it goes against what they desire, what their profession, what they feel they have been called to. So, and what I've also found is that, just as I am with patients and their loved ones, I offer that space, compassionate space for them to be able to tell their stories, for them to be able to go through those emotions, and hopefully, come out of the other side more aware, more present, and that they don't lose sight of why they became healthcare providers.
Mm-hmm.
It happens in many ways, and sometimes that there's some what we call like debriefing. People go through that. Our hospital is quite good at doing that, and then we incident debriefing, and we find root causes and find ways to address that and to continue to improve care. But what I found my particular role is checking in with the individual, and sometimes, and it goes beyond what has happened to them. So as the days go by, I'll be checking in to find out how you're doing. Sometimes they want to find ways to offer apology, to reconcile, and I can facilitate that as well. So it's something that so unfortunate, and everybody involved is impacted, in different degrees.
Sure. That's a question that I have had before. Are you ever involved in the actual root cause analysis meetings, or are you called in to support individuals who may be involved in those RCA procedures?
I mainly, offer support. And again, that is kind of, for me, the whole experience is kind of a spiritual experience, and that sometimes part of our assessment is that there's a spiritual distress,
Mhm.
because of the loss or the suffering or the harm. And so my role is that support, um, uh, to be able to support and to be able to be present when people are, having that conversation.
Yeah. Good. It's good. It's good to know that that's there. And for those who are listening and you're not aware of what an RCA or root cause analysis is, after an unanticipated event where harm may have occurred or errors may have occurred there or death, there will often be a root cause analysis, and that brings the professionals together to look at what happened and the events of that, hopefully in the effort to prevent it from happening again, to learn from the experience, but also to be able to communicate to the patients and family members and the physicians to to ensure that there's a sense of honoring that
Mhm.
that event and those events, however they happen. I wish that there would be more involvement with patients and family members like myself. It's almost 8 years to the day since my husband died, and I was never even informed about whether there was a root cause analysis
Mhm.
associated with the events of his death.
Mhm.
Those simple acts are really meaningful for everyone involved, and it would be certainly my hope that chaplains like yourself would be able to support not just the staff members and the patients and the family members, but also those administrators who I think sometimes are a little farther removed from the events of care and might be a little more challenging to really feel the impact of their very influential decisions. And those are often the individuals who are weighing trying to balance between keeping a hospital open and well funded and resourced in the ways that they need to be, alongside the delivery and expenses. And I know that they're often making very difficult decisions, so I would hope that they would seek your spiritual or guidance as well. But that's just my opinion. I
Yeah.
will
I must say though that I've been privileged to be in a couple of uh, critical incident debriefing within the hospital, and um, we've had administrators there. There were one of them that we had a family there to kind of come and talk about their experience, and that was very moving. We even had EMT people who came in there. So we have had those moments, and I know that here we have what they call daily safety briefing,
mm,
that these are brought up, things are brought up every morning for us to talk through, and I am, because I'm a manager, I'm on that call, and we're able to support. In fact, we've been asked by administrators to do rounding sometimes, so yeah, like I said, I feel like, I've worked at 4 different hospitals, from a trauma 1 hospital to with Kaiser now, and this community hospital. And this is one of the hospitals that I can honestly say that what they call total health, the body, mind, spirit aspect of it, is being promoted and supported. So our spiritual care team is very much integrated in the hospital, and so I find it fortunate to be part of this to be able to ongoing and continuously help us all grapple with the full spectrum of who we are as human beings.
mm. I like the way you put that, and I really admire those hospitals and healthcare systems like Kaiser that have placed that prioritization on safety, but also on just the whole person
Mhm.
and every person involved, not just the patient, but everyone who's involved. And we know that if we're healthy, it's easier to care for ourselves and others. My hope is that model that you have had the privilege to be a part of and are influencing yourself will be emulated by other healthcare systems around the world as well, because I do know that it makes a difference. And we have very strong data to support that when that attitude and that approach is taken, it does impact not just the safety and quality of care, but it also impacts the financial care of an organization and the reviews, and the list is pretty long of the upsides that you get when that approach is taken. And it doesn't surprise me at all that your experience with Kaiser is that, just because Kaiser has been known for prioritizing that and being a leader in that way for quite some time. May we turn toward your personal perspective for just a moment?
Sure.
One of the reasons that I am traveling across the United States, from the Southern California and zigzagging for zero to Capitol Hill, is to collect interviews like this from people who are knowledgeable about safety in medical care, and to deliver that to legislators and help them prioritize committees and building committees to prioritize safety in our medical care system. But it is also to bring it to the household level, to really help everyday people who may not necessarily be thinking about safety in medical care begin to do so in a productive and proactive way, whether they're in the hospital now or they will be someday, or they'll be supporting someone. This is a tender topic, and it's one that either maybe isn't familiar, maybe they don't know that there is a high incident rate of errors and harm and deaths due to error-related events in medical care, or maybe it's just sometimes too daunting or overwhelming to think about. So I want to ask you, because you do know, and because you do have this sensitivity to really meeting people where they are, how do you speak with your loved ones, with your family members, with your community members on a more personal level about safety in medical care?
So, let me start with this. My wife also was a chaplain, and now she is a professor for pastoral care and counseling. And so she's teaching chaplains, basically training chaplains. We talk about a whole range of things. So she knows the medical setting quite well, and the healthcare setting. She's also aware of, she's African American, and the historical relationship that healthcare has with her community.
Yeah.
And so I think that there's a heightened awareness, dealing with healthcare in general. But I think I feel like we're in a pole position, because both of us understand the healthcare system, and so the conversation comes easily for us. And so we have, when there's an incident like not last year or so, she had she went to the ED and not basically not diagnosed the way she thinks she was feeling, and then she was sent home. But then she decided, we started talking about it and becoming more aware of all that. So it's something that one way or the other we all kind of experience, and also we look at it from different lenses. For me, I think being a spiritual care provider has helped me look at our interaction. I have this perspective that every interaction we have is spiritual. And so my interaction with the healthcare system, my interaction with my family, my interaction with patients, families, and staff, I look at it from that lens. And if it's spiritual, then how can I ensure that if somebody is in spiritual distress, what are the steps that I can take? How can I do the spiritual assessment to meet that need? Because harm brings suffering, brings pain. But also as a spiritual care provider, I'm able to be present and listen to people's stories, because I think what makes it unique, for me in my role is that I have the time to listen, because that is part of my role. But also that I, have the patience to listen when it's my family, because, when it comes to family, it's kind of different. But the conversation is easier for my family, I should say, because of our own experiences, in the healthcare system. But it's something that we are aware about, but also we are aware that it's a human experience. Suffering is a human experience, and we find ways to meet that need. And that conversation, I must say, is not that difficult for us. But I think, especially with the current situation that we find ourselves with COVID, we all become more aware. If you experience something, it makes you, become more aware of your surroundings, of your experiences. And then, so intentionally and proactively, you can address some of those, or you can prepare to engage, the new context that you're going to find yourselves in.
Mm-hmm. I think you make a really good point that sometimes it's our own personal experience that helps us be more proactive or prepare for a conversation. In this case, a conversation about how to make sure that you are preparing to be safe in a hospital or medical center of any kind. And it's those personal experiences, because I think if we haven't had that personal experience, or we haven't been sat down or given the talk, my family thinks of it sometimes as, okay, we're going to get the talk from Vonda. She's had that experience and she's going to give us the talk.
Mm-hmm.
And otherwise, we might find ourselves more reactive. And it certainly is my interest to be proactive with these conversations, to prevent that error to the extent that we can in the first place, and to be quick to addressing it if it does happen, whether or not there's harm, so that we get closer and closer to zero preventable harm and preventable deaths. And thank goodness there are enough of us who are willing to open up that door and say, okay, I can't tell you how many times I've been called. My little hotline has been called, when somebody has gone into the hospital or they're preparing to go in the hospital. Especially now during COVID, I get quite a number of calls around, what do you recommend? And there's sometimes it's just very basic things like take a notepad. If you can, if you have the ability to have somebody there 24/7 with that loved one, by all means do it. But don't overtire any one person. Spread it around a little bit. And I absolutely understand that that's not possible for everyone, but when it is, make it happen.
You're right, because one thing as you're talking that, I have found myself, and certainly in my family's case, but also here in the hospital, my role, part of my role is being an advocate.
Yes.
And sometimes I just encourage the conversation and advocate on behalf of our patients, and also sometimes, to engage my colleagues. And again, I say that people are gracious that you engage them. It's just like new information. Oh, we didn't know about that. Thank you for letting us know. Because, the heart is the desire is to do the right thing. And so when people get new information, then, they look at the care and kind of, how can we make it better to make sure that, this doesn't happen. So yeah, it's the advocacy part of it, and as you indicated, if there are resources that people know, we'll direct them, because sometimes people don't even know what resources are available to them.
Yeah.
you know.
One thing that I don't know if this comes up for you, but I have noticed that a lot of people don't really know that most hospitals, I can't say all hospitals, but at least the ones that I know of in the United States, and I think in many other countries as well, it's now very normal for someone to stay, a loved one to stay with that patient for the entire time. But still today, I hear this myth that, you know, visiting hours are very strict and that everybody has to clear the room by whatever time.
Mm-hmm.
And while those visiting hours are certainly still in place, it is most often it is perfectly acceptable and actually encouraged to have another person by your side, because we all know that when we're in that state of stress, I mean, there's a reason we're in the hospital, so we got a few things going on.
Yeah.
It's really helpful to have somebody else there who's listening, who's working with that care team on behalf of that patient's needs. And most caregivers today are receptive to that level of self-advocacy and patient advocacy from the loved ones. But I don't think that message has quite caught up to the household level yet. So I am hoping that people who listen to these interviews that I'm conducting will really take that away. Michael, as we start to conclude this interview, is there anything else that you think just might be helpful for people to hear that you would want to share?
So yeah, I think I'm gonna look at a context, COVID context that we find ourselves in relation to the general being safe, to minimize suffering. That this current situation is traumatized all of us. It's become a collective trauma, and so it's important to be patient with one another, to be compassionate with one another, to offer a listening ear. Sometimes just listening goes a long way to meet the need. There's certainly the understanding that the stress level has gone up. So my advice is that we all step back a little bit and show a little more compassion and love to one another. It's possible that people's filters are not functioning the way they normally function. And so it's easy to be irritable, it's easy to be angry. So we need to be a little more understanding. And then I think collectively we can, prevail in this, and just be human to human, just be human to one another. That's what I would say. Just be human to one another. And I think regardless of what profession you find yourselves in, one of the things that I believe strongly is that, like I said earlier on, that what we do, our professions, in my opinion, are expression of our spirituality. And so if we can see what we do, what we bring to the table from that lens, it brings about humility, it brings about compassion, and it brings about love. So let's, hold on to one another, show love, show compassion, especially in this moment as we proceed forward.
I really like how you phrase that, and I join you in that encouragement for myself, and I hold that for others as well. Michael, thank you very much for your time today. I'm sure people will really enjoy having heard your words and will be inspired by them.
Thank you very much, Wanda.
And thanks for everyone for listening.